Now, here's the problem. The Centers for Medicare and Medicaid Services, CMS, or Medicare as I've been referring to it, has just released their 2023 physician fee schedule. The new fee schedule has come out. And because of the formula and because of the budget neutrality requirement, CMS is proposing, or Medicare, is proposing a 4.5% across-the-board reduction in Medicare payments. Well, it gets even more difficult. Due to the $1.9 trillion deficit increase caused by the American Rescue Plan, and under our budget rules, pay-go sequestration is going to be triggered by the American Rescue Plan, and that's going to require an additional 4% reduction across the board in payments to physicians and hospitals. So unless we do something, every physician that treats a patient who is on Medicare, doesn't matter what for, is going to be paid 8.5% less in the middle of raging inflation, in the middle of not only doctor shortages, staff shortages as well. And you do not have to be a senior at Caltech to figure out that if you cut physicians' fees for every different diagnosis for which Americans seek treatment from a Medicare physician by 8.5%, physicians are going to have to either make it up somewhere or stop seeing Medicare patients. So all of a sudden, your doctor under Medicare is not taking any more Medicare payments. We don't want that. And not only that, but the Medicare fee schedule is looked to by private insurance companies when they determine how much to pay physicians under their insurance plans. My bill would freeze the current fee schedule. In this sense, not per se, but indirectly. My bill would keep physician reimbursement levels reimbursement at existing levels. So the amount that doctors are paid today for that earache would be the same next year. My bill would pause the pay-go cuts until 2024. So in effect, my bill would prevent next year an 8.5% reduction across the board to physician fees. I'm not asking this Congress just to add spending and go borrow the money and put us further in debt. I have a way to pay for it. As you know, we meaning the United States Congress, sent a lot of money to our health care delivery system during COVID to help physicians and hospitals deal with our health care crisis. We sent a lot of that money through what's called the Provider Relief Fund. These are dollars that were sent out to the hospitals and the doctors to help them get through the COVID pandemic. Our doctors and hospitals didn't use all that money. They've returned some of it, believe it or not. So I have a problem, I have a solution, and I have a way to pay for it without us having to spend money we don't have and thereby borrowing. But in order to solve this problem, we have got to do something now. And there are millions of Americans out there that are looking at an 8.5% cut to Medicare when we have an 8% inflation. That's a 16-point swing. And those millions of people are not just physicians or nurses. They're patients who depend on Medicare for life and death. So I hope that the chairman of finance, who is whip smart, will consider my proposal. It would postpone the pay-go cuts of 4%, and it would freeze the current fee schedule. If the new fee schedule goes into effect, we're going to have another 4.5% cut. That's how I get the 8.5%. And it would pay for it. It wouldn't increase debt at all.